When a new disease is seen in a society, in a country, because it is new, we may not know all the details of the disease, details of the organism, or what will happen and how to prevent it, what treatment should be given. All these we are unaware. Our type of approach will be different. We will try to know about the disease. The best thing is to prevent a disease is also we cannot do. So vaccine not available, medicines not available, we will go for other options. So we will observe how the patient reacts, how he gets cured by himself. In the meantime, we cannot leave these patients. So what we do is we observe them in a hospital and we try to treat him in a way so that it will reduce the severity of the symptoms and also duration of the suffering. And in the hospital, we are giving what is called symptomatic treatment. And we give the person's immune system to attack these organisms. So the person will protect himself by the antibodies which are produced against this virus by his own immune system. We are just managing the situation with what is available and what can be done. A permanent solution is a vaccine, no medicine. But a patient recovers. How he recovers? By the production of antibodies, patient's own immune system. With the antibodies which is produced in this person, can we use these antibodies as a medicine, as a treatment? Because he recovers because of that antibodies produced in his immune system. What is the concept of plasma therapy? A person had an attack and he was hospitalized and he has recovered. And remember, he has recovered not because of any specific treatment, but because of his own immune system. He was hospitalized, and what doctors did was they give a supportive therapy or supportive treatment, what we call as symptomatic treatment. Because there is no specific treatment, there is no specific medicine for this. So, what we could do is to avoid the complications, early diagnosis of complications, and to treat the complications so the person will recover of himself by fighting against the disease by using the antibodies from his own immune system. If a person dies, that means his immune system failed to produce enough antibodies against the organism. There may be many reasons, like his age or other diseases he may be suffering from. If he recovers completely, how? We know his immune system has produced enough antibodies, prevented the multiplication of the organisms, and it has destroyed the organism or the virus. Now the person has recovered, he has destroyed all the organisms. Now there is no virus in his body, he is now symptom free. Now the question is, what happens to the antibodies which he produced, which his immune system produced? It remains in his blood. How long it will remain, we are yet to know that. If it remains for his own lifetime, then he will not get another attack by this same organism. Now, the concept is if we separate the antibodies from the recovered patient, and if we give these antibodies to a person who is suffering from the same problem, especially when the person is not able to produce enough antibodies from his own immune system for various reasons, or the person is in his early stages where the antibody production has not started in his body, at that time, if we give these antibodies will destroy the organism which is present, and these antibodies will also prevent the multiplication of the organism. This is the concept of this convalescent plasma therapy. Remember, they will not stimulate the patient's immune system to produce antibody. Only a vaccine can do it. Right now, we don't have vaccines. In fact, a vaccine will stimulate the immune system to produce antibody. Like that, an organism also can stimulate the immune system to produce antibodies. In a vaccine, he does not suffer from the disease. Here, he suffers from the disease and his body produces antibody. And we are making use of this antibodies which is remaining in the patient's blood after he has recovered. The life of the antibodies is not very sure. We don't know how long it will remain in the patient's blood after recovery. So, a wise thing is before it disappears, if that can be separated, it can be used for another person, and this forms the basis of this convalescent plasma therapy. This is a ready-made antibody which we have borrowed from another person. The concept is what we call it passive immunization, that is, producing antibody in some other person or in some other animal, getting the antibodies, separating the antibodies from that person and animal, then using it for another person. You call it passive immunization. When I say immunization, it's a preventive measure, but here we are using it not as a preventive measure, but as a treatment, therapy. Here also, these antibodies will circulate in the patient's blood for some time for whom we are giving, and during that some time, it will prevent the multiplication and it will destroy the organisms so that we are helping the patient to recover from the disease before he develops complication. This is not the first time we are doing it. This has been tried with some appreciable success rate in Ebola virus case, the Middle East respiratory syndrome in 2015, and in H1N1 infection in 2009. Why don't we give the whole blood from the person who has suffered? The answer is we don't need whole blood because what we need is only the antibodies. The antibodies are present in the plasma. So instead of giving a whole blood, we take the plasma, we separate plasma from the whole blood. The plasma contains antibody, and this plasma can be used in which the antibody is present against the virus. For example, if the person is having a dengue-like disease, in dengue, we have less number of platelets. In that case also, we take the platelets alone from somebody's blood and we can give that to a person who is suffering from dengue. The same concept is here also. If a person is suffering from anemia, in which a whole blood can be given. Now we should know what is convalescent. During a disease, you have three phases. One is the incubatory phase, second is the illness period, the next is the convalescent period. Convalescent period is nothing but the patient is given rest so that he will regain the strength which he lost during his sufferings. So that period which follows after a recovery is called convalescent period. During this convalescent period, the importance is he may have small number of organisms. He is called convalescent carrier. But remember, he will have a lot of antibodies against that particular organism during that period and after that period also. We'll see the composition of blood first. Every person has got around 4 to 6 liters of blood. That's a quantity of blood. On an average, around 5 liters. It contains two parts. One is the cellular portion, another is the fluid portion. If you take 100 ml of blood and allow it to stand in a small test tube, after half an hour, you can see the upper portion, a fluid portion, and a lower portion, a cellular portion. The lower part looks red. It is full of RBCs or red blood cells. The upper part is called plasma. In this 100 ml of blood, around 45% is made of plasma, the fluid part. The remaining 55% or 55 ml in 100, they are nothing but the cellular component of blood. These cells are nothing but the red blood cells. These red blood cells They are very important because they are the one which carry oxygen and carbon dioxide between the lung and the tissues. But for us, we don't need the RBCs or the cells. What we need is a plasma, and specifically, what we need is the antibody which is present in the plasma. So instead of taking the whole blood, we can separate only the plasma. After that, we can give back the RBC to the person who is giving the blood. The concept of this plasma therapy is not new because we have been doing it in some other occasions for long. For example, a very good example is the treatment of snake bite. What we do is we introduce the snake venom into a horse, and the horse produces antibodies, and we take the antibodies from the horse blood. We get the antibodies from the horse blood, and we are using it to treat or to neutralize the snake poison or snake venom or snake toxin when a person is bitten by a snake. So the concept is not new. Now, what is this procedure called? This procedure is called apheresis. Apheresis means instead of using the whole blood, we are separating the blood into its components. The components, as I told, the red blood cells, or it may be a plasma, the whole plasma itself, we call it frozen plasma, or sometimes we take the platelets. In this occasion, we are going to take antibodies from the plasma. So you have what is called whole blood transfusion or component transfusion. So we call this as harvesting of antibodies. So what really happens? The blood of a donor or the patient is passed through an apparatus or a machine. He is hooked to that machine, and his blood goes into that machine, and that machine separates the plasma, and through the other end of the machine, and the RBCs are given back to the person. So we are taking only a component of the blood, namely the plasma, and we are returning back the functional component of the blood, namely the red blood cells. So the person who is giving blood, he will not suffer, or even he doesn't even feel tired because his RBCs are given back to this person. These antibodies are given to the person who is suffering. But what is the duration of protection for this person? It is only a temporary protection. In fact, we are not giving it as a protection, we are giving it as a treatment. So, the days in which these antibodies will work is only limited time because these antibodies are not produced by this person. We have borrowed it from someone else. So, what really happens before it disappears from the person who receives this antibody, it will kill the organism. Procedure is like almost like a blood transfusion or donation. All the precautions are taken. The blood is checked for all the infections, the possible transmission of infections. They are all excluded. We test for the diseases which are transmitted through transfusion. We do the grouping and matching. Everything is done. Very important is if you are taking a whole blood from a person, what usually is done in a blood transfusion or blood donation, we usually give minimum 3 months for the person to recover or for the person to produce new red blood cells. But here we are returning back the red blood cells. So we are taking only the plasma. And each time how much of plasma is taken is around only 200 ml of plasma is taken and it is given to the patient. How many times we can take from a patient? Usually you can take 2 times in a week's time. And these 2 times we can infuse this plasma to the patient. So it is very useful. From one patient is adequate to treat one person. So what we need is only a person who has recovered from this disease. The only thing is we should have enough antibodies. Sufficient amount of antibodies must be administered to this person. So we'll always check how much of antibodies are present in the donor's blood. or the person who is giving is the donor. If that is possible, why can't we try this in other people, in normal people, before they get the disease? That means you are asking, why can't it be used as a vaccine? Theoretically, it is possible. But remember one thing, to get antibodies, we should have patients who have recovered. Our aim is not to produce more patients and take more antibodies from those people. Our aim is to control the infection. The patient criteria or eligibility. The patient should be a confirmed case of COVID 19 and he should have a life threatening COVID 19. And what is life threatening? A severe disease that he should have shortness of breath, difficulty in breathing. His respiratory rate or frequency of respiration must be more than 30 per minute, and his blood oxygen saturation should be less than 93%, and he should have some lung problem proved by a scan or an x-ray like that, or a person who is going in for respiratory failure or a shock like thing, etc. These are all the criteria who are eligible for this type of treatment. We saw the patient eligibility. Now it is the donor. Who can give or from whom we can take this plasma? It should be collected from people who meet the eligibility requirement or criteria. One is he should have suffered from this disease, which has been proved by tests, either a diagnostic test or a serological test that he has recovered. Diagnostic test sees the organism, serological test or the rapid test, they see the antibodies. There should be a complete resolution of symptoms, at least for the 14 days. He should not have any symptom for the past 14 days before he is giving this donation. And next is how much of antibody is present. That will be checked. Only when we get more number of antibodies, it will be effective. We do a titration to know the quantity of antibodies present in this person. There are a lot of doubts. The doubts are very much reasonable. Will there be any problem for the donor? Will his immune system become weak? Definitely not. Immune system is not disturbed here, and it will produce antibodies as usual in the person who is giving the plasma. Next, will it transmit some diseases? No. From the donor to the receiver, no transmission. We are checking that. For the donor also, nothing will be transmitted because he is only giving, he is not receiving or food for the donor. Nothing special. In fact, his red blood cells are returned back to him, which are the functional unit of blood for that matter. He won't suffer after donating his plasma. So it is only the fluid portion that is taken. That too, only 200 ml is taken. So nothing will happen to the donor. Can it be used for all normal people? No. It is not a vaccine. We are using it as a treatment now. The life of that antibodies, we are not very sure. Whatever the life, if it is given to a person who is suffering, it may be useful, but it is not to be used as a vaccine unless it is proved. Should we stay in hospital after donation? No. The person can walk off after having a small relaxation, nothing more, because he is giving a part of the blood, not a whole blood. So no need for. Will the person receive? He is immune to it? No. He is not immune because we are not giving a vaccine. We are giving a ready-made antibodies produced by some other person. So we are using it as a treatment, not as a prevention. It is not used and it cannot do the function of a vaccine.